The home stretch. Love that the attendance is still very good. And again, as a reminder, Dr. Derek De Silva, who many of you know, will be talking about the AMMG certification right here as soon as Dr. Schneider is done. So just if you want to take a short bio break at the end of Dr. Schneider's lecture, that's fine. And then Dr. De Silva will start. Our next speaker is Dr. Schneider, who is an internist but came over to the right side of medicine, is now practicing integrative medicine, and he's going to talk to us about the role of stress and stress reduction in age management medicine. Dr. Schneider. Thank you.
Good afternoon. It's been an exciting conference here on age management medicine, and one topic that's been touched on but not gotten into very deeply has been the topic of the mind and the brain and its relationship to the aging process. And also it's been touched on but not gotten into very deeply the role of the mind in managing the aging process, the role of stress reduction, particularly with meditation. That'll be the topic that I'll be talking about with you today. Much of this work that I've conducted with my colleagues has been supported by the National Institutes of Health, National Heart, Lung, and Blood Institute, and the National Center for Complementary and Integrative Health. In overview of what I'll be talking about today, two main points. First, the relationship of stress and the aging process and its physiology. The second point will be the evidence for the contribution of stress reduction, particularly with meditation, on managing the aging process. First, back in the 1980s, Rowan Kahn first proposed the idea that one can manage the aging process. They may not have been the very first, but I think they were the first to widely publicize the concept of usual versus successful aging. And that's what this conference is all about. How we can maximize physical and mental abilities, how we can minimize disease risk and disability, how we can help our patients engage in active life activities, and how we can also help them maintain a positive spirituality as part of total optimal aging. Well, how do we do that? In terms of investigating the role of the mind, I've been working a lot in preventive cardiology over the past 30 years, and this is the InterHeart study of 50,000 post-MI patients and various risk factors contributing to their coronary heart disease. As you can see, smoking, diabetes, hypertension, obesity, and dyslipidemia were all confirmed as major cardiovascular risk factors. But here's the news from this study. Psychosocial stress was found to be as strong a risk factor for coronary heart disease as the conventional biological risk factors. High psychosocial stress was roughly associated with double the risk for coronary heart disease. Does anyone have any patients that deal with psychosocial stress in their lives? Does anyone here in this room deal with psychosocial stress? Okay, well, this applies to you, your patients, and just about everyone in the world. Here are some mediators that have been found to link the brain and depression or psychosocial stress, physiological correlates of psychosocial stress that in turn lead to cardiovascular disease and other diseases and disorders associated with aging. We've heard a bit about cortisol during this conference, but there are many other physiological mechanisms of psychosocial stress. They include increasing inflammatory cytokines, increasing telomere attrition, and increasing reactive oxygen species, free radicals, and impairing insulin sensitivity, impairing GABA, a very important neurotransmitter, decreasing anti-inflammatory cytokines, decreasing telomerase, which of course repairs telomeres, and decreasing natural antioxidants. So there are many mechanisms by which cellular aging can be accelerated through the brain. Now, what are the psychosocial stressors and responses that activate these physiological mechanisms? This slide summarizes decades of epidemiological research that link stressors and the stress response to stroke and other disorders associated with aging. On the stressor side, these are external events, life events like losing a child or losing a spouse, physical disabilities, other diseases can cause stress, of course, work stress. Earthquakes is in there. That means natural disasters generally. When I was doing my fellowship training at the University of Michigan in the field of hypertension, we were studying the relationship between blood pressure and stress. And just next door to Ann Arbor was Detroit. And Detroit has different neighborhoods, different socioeconomic neighborhoods. Some wealthy, high SES neighborhoods and some low SES neighborhoods. And what my colleagues found was that blood pressure was higher in the lower socioeconomic neighborhoods compared to the high SES neighborhoods, controlling for other confounding factors. So there's something about the stress of poverty, there's something about the stress of racism, there's something about the stress of ordinary life events which activates the hypertensive mechanisms and other mechanisms associated with aging. Since then, biomedical scientists have found that it's just not the stressor, but it's the stress response, which is even more important, how we respond to the external stressor. So if our patients respond with depression, distress, sense of low well-being, hopelessness, which can be measured actually, hostility, anger, low contentment, all those accelerate the physiology of aging. However, there are adaptive or coping psychological responses which have the opposite effect on the physiology of aging. And they include optimism, low pessimism, which is the opposite of optimism, or associated with optimism, positive coping, perceived level of life enjoyment, sense of coherence, togetherness. The opposite of coherence is my life is falling apart. I just can't keep it together. Well, if you feel that way psychologically, then that causes a cascade of physiological events which are associated with incoherence and a positive attitude towards life and aging. So those are positive psychological states compared to the negative psychological states which are associated with cardiovascular disease and other disorders of aging. Let's go more deeply into the biology of these states of mind or states of consciousness, if you will. This is a review article by Peter Libby from Harvard Medical School, one of the main proponents and the main discoverers of the stress, immune, cardiovascular disease connection. And Dr. Libby describes in the right-hand side of your chart here how stimulation of the central nervous system through anxiety and depression and the other psychological states that we just looked at turns on the sympathetic nervous system, turns off the parasympathetic nervous system, and through beta-3 antagonism, or agonism rather, and perhaps other mechanisms, this stimulates the bone marrow, leukocyte stimulation affects the spleen, and then pro-inflammatory monocytes released into the bloodstream. They lodge in the coronary arteries, contribute to the inflammatory cascade of atherosclerosis, leading to thrombosis, myocardial infarction, and perhaps death. So the pathways linking the brain, the immune system, the brain, the nervous system, the immune system, and the cardiovascular system are now fairly well described. It's no longer just in the realm of psychology. This is physiology now. This is Dr. Elizabeth Blackburn, who won the Nobel Prize about 10 years ago for the discovery of telomeres and telomerase, those ends of the DNA which are so important to aging process and chronic diseases associated with aging. And Dr. Blackburn also published with her colleague, Dr. Eppel, the relationship between states of stress and telomere length in a famous PNAS article in 2004. And here she's showing how caregivers who report high psychological stress in their lives actually have shorter telomeres than matched subjects, in this case women, who report low stress. Since then, this kind of effect has been replicated many times. Now let's talk about the biology of how stress could shorten telomeres. Stress is generally believed to be processed in the prefrontal cortex, the front of the brain. Then there are other brain centers involved. The amygdala is very famous now for its role in processing stress, a hot amygdala or a cool amygdala. And those inputs are transferred to the NTS, the nucleus tractus solitarius, which regulates the autonomic nervous system, turning on, in this case, the sympathetic nervous system outflow, reducing parasympathetic nervous system outflow. That affects the immune system, as we just highlighted earlier. Adrenergic stimulation affects TNF alpha, affects interleukin-6 and other cytokines. They affect cell activation, NK kappa B, and that affects mitochondria, reactive oxygen species generation. And it's the oxidative stress which is thought to affect damage the telomeres themselves, reduce telomere length, and damage telomerase in DNA repair, speeding up cellular senescence, the cellular basis of aging. So here we have a cellular understanding of how psychosocial stress can be translated to sympathetic effects, immune effects, cellular effects, and effects on telomeres, which are so central in the aging process. This represents the culmination of what's known now, up to date, in telomere biology and environmental effects on telomere length. So on the left-hand side, we have healthy, normal, long telomeres, and there are both intrinsic, internal, and external influences. You could think of the environmental influences as kind of epigenetic influences on telomere length. So we know that intrinsic influences cell division and age. Age is the greatest known contributor to telomere length. Inflammation, immune system activation, DNA damage contribute along the way. And intrinsic telomerase and sex hormones also affect telomere length. On the environmental side, it's now very well known that lifestyle, for example, nutrition, smoking, even quality of the air that we breathe, air pollution, affects telomere length. Mental stress, which we're highlighting in today's talk, and physical stress, and the opposite, healthy lifestyle, exercise, and lowering stress, which we're going to go more deeply into today. So there you are, long telomeres, short telomeres, and epigenetic influences or environmental influences that we can control. This is a systematic review and meta-analysis on stressful life events and their prediction of telomere length. The main point that adverse events throughout life have been shown in about 15 or 20 studies to affect telomere length, especially childhood adverse experiences, losing a parent, for example, or physical abuse as a child, but even adult adverse events like chronic stress associated with caregiver cares we talked about earlier has been shown in many studies to affect telomere length. This is the triad that is the current thinking by Epple and Blackburn in their group on the relationship between high levels of stress exposure and it's associated with the stress response. Different people have different stress responses, and we'll talk about how to modify the stress response today. But that association between stress, the stress response, and telomere biology is pretty well laid out now. And the biology of that relates to allostasis, which is basically homeostasis, physiological homeostasis, and stress affects inflammation, insulin resistance, mitochondrial function, and dysregulated autonomic and neuroendocrine activity as mediators of this stress-telomere relationship. At every stage of the lifespan, telomeres are there, and at every stage of the lifespan, psychosocial stress can affect telomere length and activity. From the prenatal period, it's been shown that maternal stress influences the telomeres of the unborn child. To early childhood adverse experience, of course, Freud suggested that about a decade ago, that early life stress affects adulthood. His theories are rather controversial, but the part of that theory that's been supported now are these studies on telomere biology, that early life stressful experiences do affect telomere biology. Adolescence, these authors write that adolescence is the common onset of stress-related psychiatric disorders, or teenage stress is associated with hippocampal activity and lowered telomerase in the hippocampus, even as a teenager, young adult. And then later on in adulthood and later stages of life, influences are there as well. So at every stage of the lifespan, our environment, our stress response can affect our aging biology. And aging begins not only at birth, but even in utero when looking at our DNA and telomeres. Okay, let's flip to the concept of, can we reduce psychosocial stress and slow cellular aging? This is a review paper by Epple and Blackburn, our Nobel Prize winning team, published in the Annals of the New York Academy of Science a couple of years ago. They titled their article, "Can Meditation Slow the Rate of Cellular Aging?" And I'll review some of their work and some of our work that's contributed to this concept. First, I want to share with you that the American Heart Association reviewed some of this work on stress reduction and cardiovascular aging. They published a scientific statement on alternative approaches to reducing blood pressure. That was in 2013, and they reviewed various behavioral methods, including meditation, other stress reduction techniques, biofeedback, yoga, as well as procedures like acupuncture and exercise. And I'll focus on the first category, their review of behavioral methods to reduce blood pressure. I had nothing to do with this study. I learned about it after it was published, although they reviewed some of our work, some of our NIH-sponsored randomized trials. So their objectives was to critically review the literature and give guidance to practitioners like us and recommendations for future research. Here's one of their conclusions. Alternative treatments that include a particular meditation technique called the Transcendental Meditation Technique are recommended for consideration in individuals with blood pressure greater than 120/80. And now you know that with the new definition of hypertension, about half of American adults have hypertension, which is now defined as over 130. No longer 140 is the cutoff, over 130. So 25% more adults in the past year have become hypertensive, and even individuals with BP greater than 120/80 are considered at risk with elevated BP. What are we going to do with them? Are we going to put thiazides in the tap water? Well, we could. There's the poly pill, which has been suggested for everyone like a vitamin. But maybe we should think about lifestyle, maybe we should think about these behavioral influences first before we give pharmacologic agents. And that's what the AHA did. Let's look a little bit more about this meditation that they said was particularly effective. The oldest known technique of meditation comes from the ancient yoga tradition. Yoga is very popular in the world, in the United States and around the world these days. It actually dates back several thousand years in the ancient Vedic times of India. Their textbook, the main textbook of yoga, is called Patanjali's Yoga Sutras. And he said thousands of years ago, the state of yoga, or the meditative state, is the least excited state of consciousness. Well, what does that mean, a least excited state of consciousness? In modern times, this ancient technique has been revived and called transcendental meditation and taught all over the world. It's standardized and validated. And we and others have done a bunch of studies on it and some comparative meditation studies. And what happens during this technique, the subjects in these studies sit down, close their eyes, and then they start this very easy practice, and then very naturally, their mental activity settles down. There are people normally thinking a lot of thoughts, and that's a lot of mental activity. But during this practice, their mental activity gets more quiet, more settled, more subtle, more quiet, until they say that they experience a state of inner quietness. They're not asleep, they're not napping, they're not dozing, they're wide awake, just quiet inside. Just settled, not thinking, just being, as people say. And this has been called a state of inner quietness, inner silence, or transcendental consciousness, if you will. That means transcending the ordinary states of consciousness to experience this quiet inner state. And many people believe that this is a state originally ascribed by Patanjali and practiced for thousands of years, and now by several million people around the world. Well, let's look at some physiological effects of this practice. I should say that there are long-term changes in blood pressure, which the American Heart Association reviewed, but also acutely, there are changes in EEG activity towards increased alpha, in coherent activity in between right and left parts of the brain, front and left. So this coherent intense alpha is one CNS signature. And then physiologically, there's reductions in autonomic activity and metabolic activity acutely, and reductions in stress hormones. That's what happens during the 20 minutes of practice of this meditation technique. Now, this is a randomized controlled trial showing people who were randomized to practice this meditation technique 20 minutes twice a day with high blood pressure for 3 months. That's in the lower bar. The middle bar are subjects who are randomized to a muscle relaxation technique, progressive muscle relaxation, which was matched for the same time and attention as the meditation group. They got the same 8 hours of instruction over 5 days. They practice at home for an average of 20 minutes twice a day, or instructed to practice for an average of 20 minutes twice a day. And they had the same level of expectancy. So the non-specific placebo-type effects were controlled for. The third group, EC, got an education control. They got what most of us learned in medical school to tell our patients with hypertension for lifestyle modification: reduce salt, lose weight, get more exercise, and avoid stress. So that was a third group. They were told to lose weight, get more exercise, and avoid salt, and reduce their stress. These are changes in blood pressure over 3 months' time. It's systolic. There was no change in the education control group. There was a significant reduction in the muscle relaxation control group, about 2 millimeters. And then the transcendental meditation group reduced by about 10 millimeters in this study. So this was published in the AHA journal Hypertension and made big news at the time. The headlines read meditation instead of medication for hypertension. That was the first randomized trial. This goes back to the study on the acute effects that I was telling you earlier. These are the EEG changes on the top and peripheral physiological changes on the bottom. This is a meta-analysis showing that this state is different from ordinary eyes closed rest. So that's why physiologists have proposed this as a fourth major state of consciousness, because of the EEG shows settled wakefulness, physiological resting, alert restfulness or restful alertness, fourth major state, different from the physiology of waking, dreaming, or sleeping. With acute blood pressure reduction in hypertensive subjects and the chronic changes that I showed you a minute ago. Now, this shows some studies comparing different forms of meditation. This is kind of a generic word these days, kind of like exosomes maybe. It's more of a generic term, but when cognitive neuroscientists have looked at different practices, they found that different practices have different physiological effects, and not all meditation is the same. And actually, you can think about different forms of meditation using this idea on the left-hand side of your screen, cognitive control. How much work, how much effort is involved in the practice. So there are techniques of concentration, where you concentrate on your breath. You concentrate on a mantra. You concentrate on a candle. You concentrate on a sound. You're focusing your attention, or you're trying to empty your mind. Those are a traditional set of practices which certainly have physiological effects. And when you look at the EEG, they're more in the gamma range, fast EEG patterns. The second kind of meditation that cognitive neuroscientists have described is called open monitoring style. This is popularized now as more mindfulness kind of practice, where people are not concentrating on a particular sound or thought or image or their breath, but they're monitoring. So they're sitting there watching the thoughts go by, watching their feelings, and being separated from them. And that's a kind of observing or monitoring. It's a kind of mental activity, but less cognitive control, less effort, some but less than the first kind. And that has a theta brainwave pattern on average. The third kind of meditation is this, what's called automatic self-transcending. It's this described as an effortless practice where people's mental activity settles down in this automatic reflex kind of physiological way. And this automatic transcending is associated with alpha brain activity, which is relaxed wakefulness. So there are different brain states. You can go next door to the show and you can have your brain waves measured, or find out about equipment to measure the brain waves of your patients. And if you do, and they practice these different techniques, this is the average of what's been found in the scientific literature. So what you do with your eyes closed matters. And all meditations don't have the same effects. Now, this is a meta-analysis of 12 randomized controlled trials on meditation and blood pressure since the original trial that I showed you earlier. This is 2015, and the average reduction in blood pressure is about 5 millimeters of mercury systolic and about 3 millimeters of mercury diastolic. That's in all patients. And when you look at hypertensive patients, the reduction in BP is about 7 millimeters systolic and about 5 millimeters diastolic. Now, is this clinically meaningful? Of course it is, because the average of other forms of lifestyle modification is the same or less. If your patients actually exercise regularly, if they actually reduce their salt intake, if they actually reduce their weight, as you recommend, then their blood pressure would reduce the same or less according to the published trials. And this reduction in blood pressure might be sufficient for those in the new stage 1 hypertension, the 130 to 140 range, for whom lifestyle modification is the first recommendation if they don't have known cardiovascular disease. And of course, those patients in the 120 to 130 range, or as adjunctive therapy for patients with higher blood pressure. When reviewing all this data in 2013 that I just showed you now, the AHA Scientific Committee concluded that alternative treatments that include transcendental meditation are recommended for all patients with high blood pressure, as we mentioned earlier. And when they reviewed the comparative studies of different forms of meditation, like this is a comparative meta-analysis of muscle relaxation, stress management, biofeedback, and combination therapies, looking at those well-designed randomized controlled trials with adequate design features. Most of those methods were actually not effective, not statistically significant in reducing blood pressure. Although you can get an app on your phone, you can watch a CD, you can watch any number of YouTube shows these days on how to meditate, any number of books. If you want to practice evidence-based age management medicine, here's some evidence on different forms of meditation and stress reduction, and this meditation technique continued to be statistically significant in reducing blood pressure in this comparative analysis. That's why, don't take my word for it, take the scientific committee's word for it, the transcendental meditation technique is the only meditation practice, including MBSR, which is mindfulness-based stress reduction, that has been shown to lower blood pressure, that other techniques either have insufficient evidence at the time of the review or had negative evidence. That was blood pressure. Let's look at some behavioral risk factors for aging and cardiovascular disease. This is some work directly on psychological stress. This was in a high stress and anxiety group known as college students at American University in Washington, D.C. This was a randomized trial. Half got meditation, half got control. We measured their psychological distress before and after a semester. All the students had the same exams. They had the same boyfriend or girlfriend problems, the same parent issues, the same external stressors, but their intrinsic responses diverged. The active stress reduction group showed reductions in anxiety, depression, anger and hostility, total distress, and improved coping ability. So that's the psychological theory that if you improve your ability to deal with your environment, then you have a reduced intrinsic or internal psychological distress. And actually, the patients with high blood pressure in this study, the subjects, had lower blood pressure associated with lower psychological stress measures. This is a systematic review and meta-analysis of different forms of meditation and psychological health, comparing mindfulness, a group of other meditations lumped in one category because there were a few studies in each of them, and this traditional form of meditation that we've been describing, showing that all of them have some effects on improving psychological health. So that's there. But experiencing this fourth state of consciousness, a state of restful alertness, this transcending state, as people call it, seems to have even greater effects on reducing psychological stress and improving internal stability. This was a trial funded by the Department of Defense, published late this fall in Lancet Psychiatry. This was a randomized trial in post-traumatic stress disorder patients. We did this with colleagues at UC San Diego and the VA hospital in San Diego. 200 vets with PTSD, men and women, all military service, were randomized to meditation, prolonged exposure therapy, which is the best known psychological therapy for PTSD, and health education, which is with class control. And we looked at various measures. The first two, the left-hand side shows an interview measure of PTSD. The middle is a checklist or pencil and paper test. And the right-hand side shows changes in depression. And this was a non-inferiority trial to see if meditation would be at least as effective as the best-known psychological therapy, the best-known therapy generally for PTSD. And the trial showed that meditation was non-inferior, means at least as effective as the best known psychological therapy, and in some secondary outcomes was superior to prolonged exposure therapy on depression and some other secondary outcomes. So the VA is very concerned now about PTSD, and I think all of us should be concerned about PTSD, not just in our veteran patients, but so many of our patients have post-traumatic stress, and here looks like an effective therapy for that condition, which also contributes to cardiovascular disease and the whole immune cascade associated with aging that we've been talking about today. Insomnia, sleep quality is very much related to aging, and we could give melatonin, and that has some effects. We could give Ambien, that has some effects. This is a study of meditation and insomnia, showing it was an uncontrolled study, but suggests that 1 month, 2 months, and 3 months after learning this meditation practice, subjects reported faster time of falling asleep. And that's been replicated in other studies. Other cardiovascular risk conditions associated with aging, insulin resistance syndrome, which we've talked about in this conference as related to the physiology of aging. This was a study done at Cedars-Sinai Medical Center, published in the Archives of Internal Medicine, NIH funded, where coronary heart disease patients were randomly assigned to an education class, how to live healthily, versus this meditation matched for time and attention. And the meditation group showed an improvement in their insulin resistance as measured by the HOMA index. So we know that stress can aggravate our diabetic patients and can aggravate glucose intolerance, even in our pre-diabetic patients. So here's one method that could contribute to insulin resistance improvement. We did a small study, pilot study with heart failure patients. Sympathetic nervous system activation is thought to be one of the mechanisms of heart failure. So what if we could reduce sympathetic activation non-pharmacologically, which was the hypothesis of this study. And this was the 6-minute walk test. We took heart failure patients who couldn't walk very well, didn't have much exercise tolerance. We had them walk for 6 minutes and measured their distance, and found that those patients who were able to reduce their sympathetic tone through meditation actually had improved heart failure function. We're now engaged in a larger trial to follow that up. Oxidative stress, so important in the biology of aging. This was a cross-sectional study looking at oxidized lipids, lipid peroxide, in meditating individuals compared to controls. Some of the legends are not showing on the slide, but basically we matched for diet. And if you look at the unmatched subjects or the subjects matched for diet, the green bars show the meditating subjects, even after controlling for diet, had lower circulating levels of lipid peroxides, a measure of reactive oxygen species. Those are some physiological and surrogate endpoint effects of stress reduction. What about the bottom line of clinical events, how long people live, the bottom line of age management? We looked at quality of life. Now we'll look at quantity of life, as well as how often they stay out of the hospital. This was a randomized controlled trial funded for 10 years by the National Heart, Lung, and Blood Institute, published in the AHA's journal Circulation, Quality, and Outcomes. And in this trial, done in collaboration with Medical College of Wisconsin, we randomized 200 patients, coronary heart disease patients, got them out of the cath lab, all had CAD, at least 50% stenosis, randomized half to usual care plus an education, health education class, half got meditation instruction for 20 minutes twice a day. We followed them for an average of 5 years. The whole study took us 10 years because of when people entered and exited. The whole study took us 10 years. And this is the Kaplan-Meier survival curve showing disease-free survival, showing rates of death, non-fatal MI, and non-fatal stroke. Top bar is the meditation group, bottom bar is the control group, and as you can see, there is a relative risk was 0.52, meaning a 48% reduction in death, heart attack, and stroke in the group who added meditation to their usual medical care. This is the same data replotted as a bar graph, a little easier to understand. The cumulative event rate in the control group is on the left. The cumulative event rate over an average of 5 years or over 10 years of the study is on the right. You can see graphically the 48% reduced risk of death, heart attack, and stroke from managing their minds. Certainly, other aspects of lifestyle has an effect, and there are many interventions that have an effect. But for comparison, statin lowers hard cardiovascular events by 30 or 40%. Blood pressure lowering medicines reduce these events by about 25%. So this is clinically significant and as strong as many of the medications we use in our cardiovascular aging patients. But these patients were already taking their medications according to their usual providers. This is like adding on a whole new class of medication using the body's endogenous pharmacy, we could say. The CNS cardiovascular connection, the CNS telomere connection, we think. Summary of the findings, the lower clinical events. In addition, there was lower blood pressure over 5 years in these patients with this behavioral intervention, reduced psychological stress, and there was a dose response curve. So the more regular the patients practiced their meditation, the greater was their survival, just like a pharmacologic dose response curve, to a maximum of twice a day, which is the peak of the curve. This is another trial, another meta-analysis, looking at mortality rates in people who had high blood pressure and randomized to meditation or various control groups. And in this survival over 8 years, sorry about the horizontal axis, but that's an average of 8 years, there was about a 30% reduction in cardiovascular mortality and a 23% reduction in all-cause mortality. So there you are. We want our patients to live longer, and here are a couple of studies that show using your mind to settling down your mind and creating improved allostasis can actually result in reduced risk factors for aging and the bottom line of life expectancy. Looking at all this work, about 1.5 years ago, the American Heart Association issued another scientific statement, and they said, studies of meditation suggest a possible benefit on cardiovascular risk, very relevant to aging, and meditation may be considered as an adjunct to cardiovascular risk reduction. So there you are, the conventional medical bodies now, even outside of the age management community, are now recommending mind-body intervention as a therapy that we can use in our armamentariums in our clinical practice. What's the next frontier in mind-body aging? I think it's in epigenetics, and we've talked about epigenetics over this weekend, how we have the genome and the epigenome, and how the epigenome is influenced by environmental and behavioral factors, and that influences aging and diseases associated with aging, like cardiovascular disease. This is an epigenetic study that we did also with NIH support in Washington, D.C. These were hypertensive subjects randomized to meditation or education control, and we measured telomerase, actually telomerase gene expression, the RNA for telomerase. And we found on the right-hand side of the chart that the health education group before and after 4 months had improved telomerase gene expression, which is great. And that confirms other studies which have shown that lifestyle modification, healthy lifestyle, affects telomerase. The new finding in this study was that those subjects who primarily practiced this meditation technique, in addition to their usual medical care, had also had improved telomerase. So this is mind over telomeres and mind over aging, the role of stress and stress reduction with meditation. Thank you. I think we have time for a couple of minutes of questions. Yes, sir. I'll repeat the question. Okay. Okay. So a gentleman was saying he was using an entrainment technique, found gamma EEG different from this meditation, but also found effects on telomeres. Yeah. Right. Very good. Good. Any other comments? Okay. Well, if anyone else has any questions or points, I'll be in the back of the room, and pleasure to see you here today.